Hi guys, why has a former Boris Johnson spin doctor been invited to speak on Sky News? So Guto Harri, who used to work for the disgraced ex-Prime Minister, gave his 2 cents on the rise of people who are out of work sick. He says something needs to be done, not because there's a health crisis, but because the state is getting too big. Disgraceful stuff. Have a listen to this.
2.8 million people are apparently too sick to work in the UK now. 800,000 people more than before COVID. The state has bloated. If you address that, then you don't have to spend so much, and then you don't have to borrow so much, and you don't have to tax so much.
Why do these people never ask the question, why is there 2.8 million people off sick? Because the NHS waiting list has gone through the roof. Why has it gone through the roof? Because the Conservatives refused to fund the NHS correctly. They've refused to invest in staff, providing them decent wages, improving their working conditions. So staff left. They left the country in some cases to work in Canada or in Australia because the paying conditions were better. People left the NHS because of the ending of freedom of movement. People left the NHS because of better conditions in other sectors. And who was responsible for all of this? This guy's party. This guy who spun for Boris Johnson for a number of years. So once again, it's about blaming the most vulnerable in society. The reason that the state is so big is because people are claiming too many benefits. We need to force people off benefits. See, this is the solution the Tories have on every occasion. Blame the poor and force people off benefits. Why are so many people on benefits? Because the NHS waiting list is so long, it's so big. If you brought down the waiting list, then so many people would be able to access work again. They can't access work because they're sick. Now, the reason it's increased post-pandemic is because many people are suffering from the consequences of that. But once again, the focus here is not on people who are struggling. The focus is not on people who are sick. The focus is on the size of the government. The government is too big. The state is too big. We're spending too much money on people and benefits. Instead of actually trying to deal with the core problem, which is the NHS waiting list, they just want to blame people. Once again, it's the easy lever to reach to. Blame the public. Blame people on benefits. And what's the solution? Bring down the NHS waiting list? No, let's just force people off benefits. Force them into jobs that they can't do, or don't pay enough, or are far away. Once again, I ask this question. Would Guto be happy with somebody forced off benefits to look after an elderly parent or elderly relative? Would he be happy with that? Would he say, well, that's the price to pay. We need to bring down the bill for benefits. It's beyond ridiculous. These people don't care about what they claim to care about. All they care about is the size of the state. They want to maximize profit for the private sector and reduce the size of government. And to hell with the consequences. Forcing people off benefits is ridiculous when there are so many people who want to work but can't work because they're on an NHS waiting list. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.